Tanisha, nini mic mute se.
Okay, thank you, Celesty. Good afternoon, everybody. Today, on the eve of World Mental Health Day, DSL had taken the initiative of having a webinar on mental health awareness and well-being. And so today we'll be talking about the nuts and bolts of mental health and how it is how mental health affects our daily life. It is something that is not talked about every day, although mental health is something we deal with every day in our lives. So we'll be starting with the presentation now. Mm. Can you guys see it, Celeste?
Yes.
Okay. Let us begin. Mm. So before we begin speaking about mental health, let me talk about health in general. So according to the World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So here, what WHO is stating is that health encompasses our physical health also, but also includes our mental and social well-being also. So uh, to be completely healthy, to be a completely healthy individual, we must not only take care of our physical health, but also our mental health, our psychological health, and our social well-being, our interpersonal issues. So this is what health means in general. Secondly, what is mental health? So mental health is a state of well-being where a person realizes one's capabilities, can cope with the stressors of life, work productively, and contribute to the society. So, uh, well-being is where a person can adapt to the challenges of life, can cope with the challenges of life, and uh, even if faced with adversity, can get back, can bounce back. So, this is what a healthy, mentally healthy individual looks like. He or she can adapt, can cope, and can bounce back from the stresses of life. Now, how is mental health different from mental illness? So many people think that when we talk about mental health, they think directly of depression, anxiety, PTSD, trauma, etc. But mental health and mental illnesses are two different things. They are not synonymous. So while mental health is a state of mind, your emotional, your social well-being, it encompasses your emotional, social, psychological well-being, and how you think, how you behave, um, how you handle your stress, how you move around. Bubutu, ibuja palangdu. It encompasses mental health. Now, mental illness is where you cannot adapt. If you are faced with adversity, ning purat hauladu, and you cannot bounce back. Or and you and you cope with the adversity in with negative coping mechanisms. So for example, while a mentally healthy individual, while faced with adversity, will bounce back and get about, mentally ill shbumbutu, adversity face the baha, they use negative coping mechanisms like overeating or not eating at all, oversleeping. Bubutu, mental illness ni masih sign or the social or the family spheres habo bunchi, they start avoiding their family members, or they have less productivity in work. So these are what mentally ill individuals symptoms are. Now, why is mental health so important? Mental health is important because our thoughts, our psychological thoughts, our behaviors, our actions, how we behave around the environment, our emotions, bubutu krip affect jadu, and as a result, uh, Jini Kushi, our productivity decreases, our interpersonal relationship, problems occur in our interpersonal relationship, our social life gets hit. Now, mental health is also important because mentally healthy individuals, they have increased productivity and effectiveness. So countless researches have been done which says that mentally healthy individuals, they are able to give more output in their work, and they are able to work to their optimal best. So it is very important to have a healthy mind to work productively and effectively. Now, it is also important to take care of our mental health because sometimes our physical illnesses are also comorbid with our mental health. So, for example, you have diabetes, for example, say you have diabetes. So, your chances of an increase in your diabetic symptoms, diabetes ni symptoms butuh raudau langadu if ninha depression dong. So there's a risk factor there. Again, if you are suffering from anxiety, if you have asthma and you have anxiety, then your risk of triggering asthma will increase. So there's a risk factor there also. And people with cardiovascular diseases, they have more risk of heart problems and more aggravated issues, complications and issues because anxiety nakledada. So our mental health is very much related to our physical health also. So we need to take care of our mental health for improvement of our physical health also. Now, what causes mental illnesses? So mental illnesses can be due to various factors. Our biological factors, how that includes genes, our brain chemistry, certain neurotransmitters might be less in our brain, because of which we may suffer from depression. Or, for example, the neurotransmitter serotonin, because of less of that, we may suffer from, say, schizophrenia. Again, biological factors also include prenatal factors, like if a baby is in the mother's womb and the mother suffers from some reactions, toxic reactions, then the when the baby is born, she may suffer from mental illnesses. Now, life experiences includes trauma, abuse. If you were sexually abused during childhood, if you come from a dysfunctional family, if you have alcoholism in the family, if you suffer from if you have any suffered from any horrific accidents, so all these kind of life experiences um, play a cause in mental illnesses. Now, if you have a family history of mental problems like depression, schizophrenia, or say anxiety also, it may be passed to you also. There's an increased chances that you might also get the disease. So it doesn't mean ki, you will suffer from it. There's a risk factor. There's an increased risk factor. Now, how to know when to seek help? So when there are these are the signs, the symptoms that show when you need to seek help. When there are changes in your sleep, your appetite, when you enjoyed around 7 hours of sleep daily but now you cannot sleep, or you sleep all the time, or appetite, you eat a lot but because of some stress you are unable to consume the food that you like. When you no longer enjoy the activities you previously did, for example, maybe you enjoy playing football, for example, and then because of some adverse situations in your life, it has taken it has made you unable to enjoy football, and you stay at home, you sleep daily. Physical health has also taken a hit. When you need to seek help when you have weight loss of more a rapid weight loss during a period of several months. So, for example, you are 60 kgs now, and because of some problems in your home or stress, you have lost a lot of weight, say 10 kgs, for example, and you are now 50 in a span of 1 month. Then there's a problem there. Now, using substance or sex to cope. So there are many individuals who use negative coping mechanisms in the daily life. So, for example, substance abuse. Substance abuse can be range from alcohol to even binge eating, for example. I have seen many students who, when they are stressed before exams, they start binge eating a lot, chips, chocolates, and substance abuse also, like alcohol, drugs. They use negative coping mechanisms. So that's when you know that you should seek help. Now, difficulty regulating emotions. So here, when you are unable to regulate your emotions, you feel very angry, or you feel sad all the time. You lash out at others, or you are unable to interact with people because you feel emotionally so drained. So that is when you need to seek help. Now, performing effectively at school, work, relationships. uh, School ha, for example, ning school ha dang fia du optimal in homework like fia du ning, or work. Suppose you are given any kind of work at in your workplace, and you are unable to fulfill those works. Relationships aboning journey optimal best refia du obaha, you need to seek help. Now, grief and trauma are also this thing important. If you have a death in the family, or if you suffer from a traumatic event in your life, then it is best to seek therapy. You want to improve on yourself but don't know where to start. Obahaboning help si klemanangdu. Now, whom do you speak to? The question is, many people don't know whom do you speak to. So they're a psychiatrist. So psychiatrist is a doctor. He or she assesses symptoms, he conducts diagnosis, and he prescribes medications. So the main work of a psychiatrist is bunchi and in symptoms assess they do, diagnose they do which what problem are you suffering from, and then prescribe medications. Clinical psychologists around that do testing and diagnosis, which is very similar to what a psychiatrist does, and they deal with more serious population. Asthma, schizophrenia, or psychosis. So mental health problems serious that okay, clinical psychologists are deal with a more clinical population. Counseling psychologists butubo assessments do testings, or they therapy do. They do different kind of treatment programs with the client, and they work with a healthier population. So if you're suffering from anxiety, trauma, depression, um, interpersonal issues, counseling psychologists do. Now, before we come to a social worker, we have to know that psychiatrists, clinical psychologists, and counseling psychologists usually work on an individual basis, on a one-to-one basis with the client, while a social worker works mostly with the community. So they also work one to one, but the main work is with the community. So they do planning, they prevent the impact of psychosocial, physical, mental health related issues. Usually they deal with it. Now, moving on. So this slide shows how a therapist is helping a person with messed up thoughts. So I would like to say that mental illnesses butune, a psychologist, a psychiatrist will only give you medicines and diagnose you. He will give you medicines to manage your issues, to manage your symptoms. He will not go to the root cause of your problems. So to solve your root cause of your issues, you have to go to a therapist. Now, handing it over to Celesty.
Thank you, Tanisha.
Yes.
Tanisha, you can keep screen sharing it.
Oh, okay, sure.
Yeah.
Oh, sorry, wait. Yes.
Thank you. Since we all know yesterday was World Mental Health Day, so let us know, why we celebrate it. So we all know that it is celebrated on 10th October. And then, can we go to the next slide?
Yeah.
Yeah. Yeah. So, World Mental Health Day was first observed on 10 October 1992 as an annual activity of the World Federation for Mental Health. And its aim was to promote mental health advocacy and educating the public on relevant issues. So, this World Federation for Mental Health, it was launched on August 1948 in UK at an international congress for mental health. So it similarly, its aim was to promote mental health and citizenship and mutual understanding through cooperation across professional boundaries and establishment of mental health services in every part of the world, and the promotion of education about mental health. And its aim was to empower people who deliver and receive mental health services. So World Mental Health Day was, yes, first observed on 10 October, and it was started as an annual activity for the World Federation for Mental Health by the then Deputy Secretary. Since then, the day is officially commemorated as World Mental Health Day. So at the beginning, the day had no specific theme. Its general aim, was to promote mental health advocacy and educate the public. And then in 1994, at the suggestion of the Secretary General, a theme for the day was suggested for the first time, and it was improving the quality of mental health services throughout the world. Um, and then the feedback that they received from 27 countries, it was really good. And then in 1995, what happened was that in America, an organization that is Pan American Health Organization, they arranged for the translation of the planning kit into many languages, and then since then, the planning kit which they use, it has been translated into Spanish, French, Hindi, Russian, Japanese, Chinese, Arabic. So since then, the federation, it has come up with many themes every year. So the first in 1996, the theme was women and mental health, and then it was children and mental health, and then mental health and human rights. So the list went on. So we all know that mental health, every day has its day, like tobacco day and then World Mental Health Day. So this day, it's not a one day event. It is that day especially commemorated, to spread awareness and stuff like that. So the World Federation for Mental Health, they created this program 26 years ago to promote mental health and to create awareness. That it's the main issue. Is the main agenda to create awareness about the issues that are associated with mental health and mental illness. Can we have the next slide, please? Yeah. So, like every year, this year, the theme is mental health for all. That is greater investment and greater access. So, why was this theme chosen? So, as we all know, the COVID-19 pandemic has, changed the globe entirely. So, this pandemic has brought great disruptions and immense challenges all across the globe for everyone. So we are all facing uncertainty, and then there's it has struck a major change in our lives, be it kids or throughout all ages and for every people. So keeping this pandemic in context, this theme was chosen. Mm. And then when we focus on the investment and access, it is solely to have greater outreach. And then can you have the next slide? So next, I'll be focusing on the investment and the access part. So in India, it's known. India is the fifth largest, largest economy, and then but the total expenditure on health is, 1.29% of the GDP, and out of which 0.05% is spent on mental health. The next slide. Yeah, and this is the mental health professionals, healthcare professionals, which we have across India. So here you can see the requirements and the availability, which is actually on ground. So here we see a large a human health resource gap. Next slide. Yes, yes. Uh, oh, oh, okay. Kichanadi? Okay, okay, okay. Okay, thank you. So these are the psychiatric hospitals which are available across India. So there are many states in India, but then if you see the number of psychiatric hospitals, it's very few. And then if you see the whole of Northeast, and then there is only one mental health institute, which is the Lokopriya Gopinath Bordoloi Institute of Regional Mental Health. And then out of all these, the highest number is the highest number of mental health institutions. It is prevalent in 3 states, that is Karnataka, Tamil Nadu, and the last one, West Bengal. Yeah. The next slide. Yeah. So in mental health, in the year 2015 and 16, the National Mental Health Survey was carried out for the first time by NIMHANS, which is National Institute of Mental Health and Neurosciences, Bangalore. So here, here it was found out that 1 in 20 people, they suffer from depression. So when it comes to, I mean, if the most common mental illnesses that people are aware or they know about is anxiety and depression, and further, if you go down, you'll see that nearly 150 million Indians they need intervention to deal with the mental illness, but then fewer than 30 million were actually getting it. Next slide. Yeah. So also it was it was found that depression was reported to be higher in females in the age group of 40 to 49 years, and those it was more um, existing in people residing in urban areas. Also, this Lancet Global Health study, which was done in 2016, it found out that suicide was the leading cause of deaths among young people aged between 15 to 39. So it's mostly the youth of the country. And then according to this National Crime Report Bureau report in 2019, it was found that suicide rate of India was 10.4%. And then every year, more than 1 lakh people commit suicide in India. And the various causes are related to professional or career problems, and then sense of isolation, and then abuse, violence, family problems, mental disorders, addiction to alcohol, financial loss, and then chronic pain, etc. So this range of mental health concerns from anxiety to anger to sleep disturbances, depression, and PTSD. These are uh, most likely to impact during this quarantine period, as people I already say, there's no sense of uncertainty and fear of what will happen, like when will the vaccine come out. So people have that anxiety in their minds. And then in 2003, when the SARS happened, up to 29% of quarantine patients had suffered from PTSD. Can you have the next slide? So this in the mental health survey, the mental health survey of India, which was done, Assam was also one of the states. And so here again, I will be referring to the latest report. So according to NCRB, it was found that suicide rate in Assam was 6.9%, and then the family problems that are responsible was love affairs, and then property disputes, and then marriage related issues, unemployment, illness, and the failure in examinations, and drug abuse and addiction. So if you see this factors, you will see that most of these problems, it can actually be dealt with, and it could be it can be avoided if you seek help. So it's we can say that a large number of these deaths could actually be minimized if help was provided, if intervention was done. Next slide. Yeah, so this is taken from the survey done in Assam. So here we can see the lack of human health resources, the psychiatrists, the clinical psychologists, and nurse, and then psychiatric social workers. We can see that there is still a huge gap to be filled in terms of this mental health professionals. Yeah, next slide, please. So when it comes to the programs, most people are not aware, and even I wasn't aware before getting into this field. So people mostly know about the mental illnesses, but then we don't really know what are the programs and legislations in place provided by the government. So this is one of them, the National Mental Health Program. This is a program by the center, and it was found that approximately 6% of the general population suffered from neuropsychological problem, and which required medical care. And it was predicted that by 2020 the number would increase by 15%. And the population is scattered all over the state, and the health services must reach to the grassroots. Now this year it's already 2020, but then the picture is still grim. And then the objectives were to ensure availability and accessibility of minimum mental health care for the future, and particularly to the most vulnerable and underprivileged sections of the population. And then to encourage the application of mental health knowledge in general healthcare and in social development, and then to promote community participation in the mental health service development, and to stimulate efforts towards self-help in the community. So if you see, if you go through these objectives, it is visible that efforts were actually made, so that help could reach. But then, if we see the present, it does not really reach up to that mark. Yeah, and also it was launched in 1982. Next slide. And then this district mental health program, it comes under NMHP, that is National Mental Health Program. And it was launched in 1996. And then it was based on the following components, that is early detection and treatment, and training, and under training, to impart training to the general physicians for diagnosis and then treatment of common mental illnesses with limited number of drugs under the guidance of specialists, which is psychiatrists. And then the healthcare workers should also be trained in identifying mentally ill people. And then IEC, which is information, education, and communication, which is advocacy and creating awareness among the public. And then monitoring, that is keeping records. Next slide, please. Yeah. So in Assam, every state has this DMHP. In Assam, it started in 1997, June 1997. So when I went to the to the official website, it said that 8 districts are covered under Assam, which is Nagaon, Golpara, Tinsukia, Darang, Nalbari, Morigao, Karbi Anglong, and Karimganj. So the standard is that all the centers the DMHP will be headed under the district civil hospital, and the human resources required would be psychiatrist, that is one psychiatrist, and then clinical psychologist, and then psychiatrist social worker, and then nurse who is qualified in mental health, and then a case registrar. So this is the the standard and the human resources which are actually required under this DMHP. Next slide. Yeah. So when it comes to DMHP, like I said, when I went to the official website, they say that 8 districts are covered. But then I think because there is, I did not find hardcore information on public domain. And then I came across a guideline, which was for the year, this financial year 2020 to 2021. And then there, I saw that the health minister, they had issued this DMHP to be implemented in all the states. All the districts. So the budget allocated was 514.58 lakhs, and for Dimasa South the budget was 8.82 lakhs. So there is this set of activities which has to be carried out, and it would be headed under this state program officer of NMHP, and then the district program officers, which will be in all the districts. So this some of the activities are target interventions at community levels. So here you can see the targets are colleges, schools, workplace, and then out of school adolescents, dropouts, and then urban slums, and then set up suicide prevention camps, and to strengthen daycare centers, and then the next activities, setting up a DMHP counseling center under psychology department in selected colleges, including crisis helpline. Tikapot Dimasa, I don't think so. We have a psychology department, and then I don't know how that is going to work out. And then for the next, they have equipments also, which are to be required during the campaign and all. Next slide. So the another set of activities are providing drugs and supplies, and then also providing ambulance services, and then training of public PHC officers, medical officers, and then paramedical workers and other health staff working under NMHP. And then it also requires translation of the IEC materials to be distributed among the public, that is information, education, and communication. And then they're also supposed to generate awareness in community schools, workplace, with involvement of the community. And then there's also a fund for travel and stuff like that. And there's also the operational expenses. So this is what I found in that operating guidelines. And this picture here is a picture that I took yesterday from the Assam Tribune. So like I said, I did not get anything in the official website. Tikabo ibo picture kede ang miha Assam Tribune ha maiba. On the occasion of World Mental Health Day, they put this up. So it looks like they are implementing it in all districts. Chicago, I don't know if it's a pilot phase, or if this is going to be regulated from now on. So that is yet to be known. Over to Tanisha.
Okay. Yeah. Am I audible?
Yes.
Yeah. Okay. So now we talk about taboos. So the stigma surrounding mental health is very prevalent till today also, and just because of stigma, people are not seeking mental health, and the reasons are the following. So there's fear and shame. People fear that they will be called crazy, or people will avoid them. There's shame surrounding mental illness also, particularly more to do with what people will think. Log kya sochenge. Then there is jukuma maya khala shubong ang lagi birse ang kigibert sijawnang. So people are very scared of being labeled. Also, the thing with fear and shame is even if you come out and seek therapy or mental help from a psychiatrist, there's a chance that the place where you're employed, people will treat you differently because of the stigma associated with mental illness. And some in the private companies, people actually dismiss you, they let go of your job because you suffer from mental illness. So that is very much prevalent. The second is limited awareness. People are not aware that they are suffering from mental illness. They fail to assess their symptoms, and that's why they fail to realize that what they are going through is actually a mental illness. Number three is feelings of inadequacy. So there's a feeling that if I go and seek help, I am inadequate, I am weak. So there's feelings of inadequacy. So even if they know that they are suffering, they will not seek help because seeking help will mean that they are weak. The fourth is distrust. Distrust that the psychiatrist, the psychologist, or the social worker will reveal their information, whatever they have told in the session, to their family members, to the public. So there's a distrust. Although professionals never discuss whatever has been discussed in the session. Fifth is unavailability of mental health professionals. So like Celesty said earlier, mental health professionals ni availability ekdam kom she. India hala kom ning kom, Assam hade orbo kom, or he in our district level are bangya daw ko. I hardly think psychiatrist uli dongjin district ha. I mean Dimasa, that's my district, sorry. Anyway, unavailability of mental health professionals ekdam bangbi. So there metros ha, in bigger cities there may be a few professionals where you can go and seek help, but when you come to the rural areas, availability becomes an issue. The sixth is lack of resources. So lack of resources due to financial constraints. Even if you want to seek help, you cannot. Or here, according to Indian budget this year, they have slashed the this one total expenditure on mental health. So now per individual, 55 paising maiba if they want to seek free mental help, free mental uh, health asba help. So there's a lot of lack of resources. People in the middle income group can seek help, but lower incomes around it becomes a difficulty. Now, this slide shows the stark difference between how people with mental illnesses and people with physical illnesses are treated. So, in the column of mental illness, you can see blame and criticism. People will say things like, "Stop attention seeking. You are weak and lazy. You chose this to happen." Or, when you show the symptoms, they say things like, "You are faking it. It's not real." Now, when you come to physical illnesses, people treat you with care and support. I am there for you if you need anything. You can fight it. You are strong. It can happen to anyone. You need rest. So, there's a certain kind of feelings with relation to physical illnesses. Because they are visible and real, people show their love, care, attention to people suffering from physical illnesses. But since mental illnesses are invisible, it goes on in the person's mind. And because of the stigma attached with mental illnesses, they say all kinds of things like, you are weak and lazy, you chose this to happen, you are faking it. So this should not happen. They are both very real and they should be treated with equal care, the mental illnesses and physical illnesses. Moving on, the role of mass media in our mental health. So with the advent of social media and print media, even movies, there's a lot of misconceptions arising regarding mental health. So, for example, inaccurate portrayal of people with mental illnesses. There are a lot of movies revolving around mental illnesses where they show people with mental illnesses as crazy or violent. But this is very inaccurate because a very small percentage of people with mental illnesses are actually violent, and they don't go around killing people like they show in movies. The actual number of normal people committing violent crimes is actually very in large numbers compared to mental illnesses. The second is portrayal of mental health professionals. So again, if you have seen movies, Bollywood movies, you will see how even Hollywood movies for that matter, you will see how mental health professionals are portrayed as in the movies. So there's this thing, psychiatrists, they portray as very crazy, very quirky, with curly hair and crazy look, and they make a lot of sexual jokes. They reveal clients' information to other people. And when it comes to mental health professionals, female mental health professionals, they highly sexualize it. Like a sexy therapist, a sexy psychiatrist. So they show all these kinds of things in our media, which we unconsciously, these kind of messages we unconsciously store in our mind about people. Now, distortion of treatments. This is very much prevalent again, where they show that treatments like electric shocks, injections, drugs that make you feel, that make you faint. So this kind of distortion of treatments are also shown in movies. Now, glamorization of mental illnesses, especially in social media and movies, they glamorize mental illnesses. Example can be taken of Batman. For example, Batman is suffering from PTSD. He has faced trauma. His parents were killed, and various violent crimes happened to him. But they show in the movies, they show him as a very handsome guy who has it all sorted, good looks, good body. Again, the glamorization of mental illnesses. Example can be taken from Suicide Squad, where Harley Quinn, uh, she is wearing a very a very short revealing clothes, for example, and she is shown as the crazy woman, and she's very highly sexualized. So glamorization of mental illnesses is very prevalent, and we should take care, how these are affecting us. What messages are we taking from the social media and the movies? Glamorization of mental illnesses also includes how, in the social media these days, if you see, mm, people use hashtags like stressed, depressed but well dressed. So it's glamorizing depression by saying that even though he or she is depressed, he or she is well dressed. Now, the last is using psychiatric and psychological terms colloquially. So psychiatric and psychological terms are used very casually these days. Like, suppose, for example, your friend is very neat and tidy person, and you must have noticed sometimes, you casually say, oh, you are so OCD, why are you doing this? You shouldn't be so OCD. Or if you have a bad day at work, you say, oh, I'm so depressed today. So this is using psychological psychiatric terms very casually. It trivializes the symptoms suffered by actual people with mental illnesses. The thing wrong with this is that when you say you are OCD, the thing with it is it trivializes the person suffering from OCD. uh, Instead of saying, oh, you are so OCD, you should just say things like, why are you so tidy, why are you so neat? Or, I'm a very neat person, I am not OCD. You should correct the people who are calling you OCD, like, I am a very neat and tidy person and I'm not OCD. You should correct them. And you should be very careful about the words you use. You should not say that, oh, I had a very depressing day. You should say, I had a very tiring day. There are other words in the English language, like, I had a very tiring day, I had a very frustrating day. So psychiatric and psychological terms should not be used very casually. We should, I mean, because we are so used to saying these things, many of us will use it casually, but we should take care before saying. Now, busting myths with relation to mental illnesses and health. There are lots of myths surrounding mental health illnesses, but today we will be talking about the 5 myths. The first is, mental illnesses are not curable. Mental illnesses are curable with proper medication and therapy, and you should seek help. Mental illnesses are very much curable. There's only a small percentage of mental illnesses which are not curable but can be managed if you seek help. Myth number 2 is, people with mental illnesses are violent. No, people with mental illnesses are not violent. It is something that is portrayed in media, as I said before, and a very small percentage are actually violent, and they never, like, very rarely they harm others. They mostly cause harm to themselves. Now, number 3 myth is, you are either fine or insane. So no, this is not true. Uh, so it is compartmentalizing fine and insane, and there's no middle ground in between. But mental health is a continuum. It goes up and down. Um, Sometimes you will be feeling low. Sometimes you will be feeling good. And if you're feeling bad, then therapy will help you. Myth number 4 is, therapy is only for people with severe mental health issues. No, therapy is not only for people with severe mental health issues. Although people with severe mental health issues do benefit from therapy. But if you're suffering from any interpersonal problems, you suffer from depression, anxiety, or anything. So you want to improve on yourself. You want to uh, mm, work on your self-esteem or anything, you can seek therapy. Number 5th myth is, I can fix problems on my own and I have my friends to talk to. I don't need to pay a therapist to do that. uh, so this is a very wrong notion among people, that whatever problems they have, they can talk to their friends and they can help. But what friends do is, they usually give advice. uh, on what to do and what not to do. But when you go for a therapy, when you pay a therapist, or when you seek help from a therapist, they will help you and provide you a treatment program which is evidence based, scientifically tested, and it is not just talk therapy. These are all scientific tested, evidence based methods. Now, what should you look for when you are looking for info on therapy or help online? So many times when we want to seek therapy, but we don't know where to start, and the best way to go is online. But there are various factors we need to keep in mind when you look for things online, which is what website is this information on, and how reliable is the information. So usually when you look online, college institutions ni sites, organization butuni site, or NGO butuni site, mostly most reliable jadu private shmutu editing blog hari bathade. So you should check how reliable information online bederi do. Now ask questions about the skills, degrees, certification. So Nishi, questions when you go for help, degrees, skills, certification, butuni question shingmanang do Nishi. It's your right since you are paying for that. Uh, because skills grihibo, degree grihibo, certification grihibo, many people do conduct therapy. I can take the example of Santoshi Shetty. She's an Instagram blogger and social media influencer. So around 2 months ago, Bu Tsiba ki, she will give therapy to people, and buntane 2,000 rupees, around 2,000 rupees buntane pay klaima, and she will talk to you for around 1 hour, or it will help you come to a solution. So she has no degrees whatsoever, certification bogri, skills bogri. So you should be very careful about whom do you go to seek help. Now, number 3 is they offer overly simple solutions for complicated problems. So overly simple solutions like I will solve your depression in 2 months. I will solve your anxiety in 2 months. I will build your self-esteem in one workshop. Bubutu, it's highly doubtful that they will be able to do it, and they charge a lot of money for that. So you should be careful when you go for such programs. Now, you should also keep in mind that does the information encourage you to think, ask questions, and make your own decision? Many a times, online information nishke potaidu they coax you into making decisions obani, and they make it seem very attractive. So you are more. They influence you to take decisions. So that should not be the case. The information available should encourage you to think, ask questions, and if it's a right fit for you, then only you should go for it. Now, red flags to watch out for in mental health professionals, be it a psychiatrist, be it a counselor, be it a social worker. These are the red flags that you need to watch out for. So if they are giving therapy, they should not encourage or ask. They don't. If they are conducting therapy, then you should be able to ask them questions, and they should also encourage you to ask more questions if you have. They should be open to you asking questions. Asma question in hadong skade bunchi na shingfumani openness dongmanang do. Bunchi open niya skade waimu nangman graushe. Now, the second is they talk mostly about themselves and give you advice. So doctors or psychologists or social workers should not talk mostly about themselves in the session and give you advice on what to do or what not to do. They should give you informed choices and help you arrive at a decision by yourself. They should not give you advice. Advice giving is not therapeutic. Now, the third is they don't react well to feedback. So, mental health professionals are not all knowing. They don't know everything. It's a fact, we are human, so we don't know everything. So when you have something to tell them, something which is not working in therapy, and they don't react well to what you are saying, then that's a red flag. And the number 4th is they make you feel uncomfortable. So if you're psychiatrist or your psychologist or social worker, they during the session, if they stick very close to you, they sit very close to you or touch you inappropriately or ask you inappropriate questions, questions that make you feel uncomfortable, questions that are in no way related to the session, it's a red flag. You should stop going there, and you should, if you are going, and if they have a higher superior, you should definitely complain about these things. Now over to you, Celesty.
Thank you, Tanisha. And I like the the last slide that you put up on the red flags. So
Okay, thank you.
yeah, that was really good. So people usually think that my doctor, or the people whom I seek help, the service provider, I should never stand up to them. Like they are doing, I'm seeking help from them. So like I am bound to tolerate everything like that. But this red flag that you put up, it was really good. It was insightful, and it actually shows that the service users, they actually have agency and they have a say in their treatment or the help they're seeking. Yeah. So Rakhee abhi ani आवाज ला ठीक से? Like is my voice fine? Ah, okay, thank you. So here, this pyramid that you see, this is by psychologist Abraham Maslow, 1946. Ibo theory ke, I mean, he introduced this. So it's known as Maslow's hierarchy of needs. So if you see it, if you see this triangle pyramid here, he has actually build this theory to put forward that unless and until we don't have the basic needs of humans, we can't actually reach to the highest point, that is self-actualization, or realizing one's potential. So let's start from the base, that is physiological needs. So here we have food, shelter. So these are the basic needs that humans need to survive. So this last thing is actually based on the survival needs which are required. And then the second you see is safety. So once you have food and clothing, you also need a good house, you need a good place to live in, a safe neighborhood, like that. And then the third one is love and belonging, that is social needs. Then you need a good family, you need friends to feel loved and to have the social support. And then the fourth one is esteem. After you have all these three needs, the next comes is esteem. So now you work on yourself, you are able to work on your academic life or your work life. So, and then the last one is self-actualization, which is reaching your highest potential, achieving your best self at work or in anything you do. So why I have put up this theory, this hierarchy of needs, is because it is very much relevant in the present time. That is COVID. So people are actually facing we have this unemployment issue. People have lost their jobs, and then people are also facing mental issues and then emotional issues. So this is actually very relevant in this time, because and just because this steps are given, this hierarchy is given, does not mean that this is the actual way it is supposed to be. There are also criticisms, like here it is shown that if you have physiological needs, if your physiological needs are met, your safety needs are met, then you reach your highest potential. But that is not also the case. Like, in present times, see, people might still be having their jobs, might still be having their daily needs are met, and they are in a very safe space and things. But then you still have that fear in you, the fear of uncertainty. So it is not that this is the actual hierarchy it should be, but then it can be interlinked. It is not this way, but this is the theory that Maslow had put forward. So if you look at the pandemic, so I hope you are able to relate to this. That people should be the basis, having your basic physiological needs met. That is food, clothing, and shelter. Can we go to the next slide? Yeah. So these are some psychosocial effects which I've noted down in the context of COVID. So, like I said, the pandemic has disrupted our lives, a daily routine. People have lost jobs. Students have had to, work from home. Study from home. So people have had to work from home. So these are some of the psychosocial effects of on our mental health. So number one is fear of losing control, living in having to live in uncertainty. So before the COVID, we had our daily lives. Like you get up, you go to work, you come back, and I mean we had our routine planned, so to say. But then because of the pandemic, it's like you have lost control. We are not allowed to go out. We have boundaries of how far you can go, what you can do. It's like our, you know, it has put a strain on our physical activities. So we have lost that sense of control that we had prior. And then the next is fear and worry about your own health and the health of your loved ones. And this is mostly for the frontline workers, our doctors, and then our nurses, and then people who work, people who I mean this what do you call, sweepers. And then those jobs, it can't be put on hold. It's like they have added pressure. So now, even if they go to work, they return, they're like, they have that fear, like, I hope I don't transmit, I don't my family members don't get it from me. So they have that thing in them, always that fear that I am helping the people, but then what if my own family gets it? So that fear is always there. And then there is also limitations in physical contact. Like earlier, when people meet, they would always high five or shake hands and then hug, but that is like completely restrained uh, in the COVID time. And then because of this constraints, we have also had to have challenges in our sleeping and eating patterns. Earlier, like I said, there was a routine, but now there is no, that traveling time is cut. So now you're like, let me sleep some 1-2 hours. So there is this change in our routines, and this change in our eating and sleeping patterns. It actually, it disrupts the body routine that we have. And then there's also difficulty in sleeping or concentrating. I mean, now the situation is a bit better because of the unlock phases happening. But then if you go back to some 3-4 months back, it was really bad. Like, we could not even step out of the house if there was an active case in that area. So then we were, confined to our houses. So that actually adds to our emotional and mental distress. And then worsening of chronic health problems, like people with, existing health problems, and long-term illnesses. So suppose somebody had, backache issue, and then so what they used to do was that earlier they would go for walks, and then go for a group, like have a meeting with their friends, and then go for some recreation stuff like that. But now, since they are confined to their house, and then physical limitations have been put, so now they are confined to their house and they are not able to go out. And then, so that hampers the physical health, and it also worsens it. And then worsening of mental health condition, and people with pre-existing mental health conditions, like somebody who has already been suffering from depression. So now it's like, an added pressure to it. There's always this fear of uncertainty, fear of and this fear of uncertainty, it's applicable to all the masses, to all the people around the globe. And then so people with already existing mental health issues, it actually becomes very difficult for them. It's like this mental health, it's like this, this COVID, it has added so much of pressure. And then it actually worsens it. And then there is also increased use of alcohol, tobacco, or other drugs. So to cope with the pandemic, with the effects of the psychosocial effects, people have, started taking up alcohol. And then there has also been cases of alcohol withdrawal, like in Kerala. There was this, at the onset of the pandemic, of the lockdown, there was this huge cases of, people committing suicide because they were showing withdrawal symptoms, since the shops were closed down. So they had problems in dealing with that withdrawal issue. So these are some of the psychosocial effects. Yeah. So most of the people, they are aware of, they are familiar with this anxiety and depression. So I would just like to show that both anxiety and depression, they are not actually the same. So here it's how they're similar. Um, when you have anxiety, you have that fear, and you have the apprehension, that doubt, and then you are nervous about things. You are uncertain about the future, and you are scared about it. So it's like it's like a stress response, in your mind, that you're scared of something like that. And depression, it's like is the aftermath of anxiety. It's like anxiety can lead to depression, but also there are also cases where it's interlinked. But this is the main thing, like anxiety is the first response that you have after stress, and then when it is prolonged, it goes to depression, it leads to depression. So here you can see that earlier, in anxiety there is fear, but then in depression there's hopelessness. It's like, you have lost hope, like that. And you have anxiety, you were uncertain about the future. But in depression, you're like, okay, nothing will happen. In anxiety, you were like, what is happening, I hope, like, what is happening around. But in depression, you're like, okay, I give up, like, mushe ja raha hu ya kha, like, this is I've given up hope, like that. Next slide. Yeah, so uh, this is, I've just summarized it. So anxiety is like your brain, is asking you to do something, and depression is saying that, don't bother, it won't make a difference. So it's like anxiety is making you think. It's like I said, it's a stress response, while depression is like you've given up. Now you have told yourself that nothing can happen anymore. So, I would just like to give a small example that I saw on Instagram. So here, a person holds a glass of water, and then asks the students, how heavy. The students think that she will be asking, is the glass half empty or half full, like that. But the thing here is that, if you hold a glass of water, and then it's like, so you hold a glass of water. If you hold it for 1 minute, 2 minute, it won't be heavy and your hand won't hurt. But if you hold it for 10 minutes, if you hold it for half an hour or 1 hour, then your hand will start paining. So this is to make a comparison with the thoughts we have in our head. So if we think about something, if we think about an issue for 5 minutes or for one day, then it's fine, like it's normal to think about it. But then if you keep thinking about it for long period of time, it will only hamper us. So that was it. Next slide, please. Yeah, so these are some of the strategies of coping. So like when I put this up, it's not like this is the only way. It's just a few which I've suggested. And then, yeah, so number one is know that you are not alone. So we have this thing in our head, no, like when we are feeling sad or when we're going through a tough time, the brain tells us that, you are the only one facing it. You're facing it alone. So this is so knowing that you are not alone, it actually it won't, obviously it won't solve things, but then just knowing that I'm not alone in this, and then I have people around me, the people are facing similar issues, it gives you a sense of, comfort. So here again, I would like to give a small example. Suppose you're sitting in a room and then the light goes off and it's completely dark. So what you do is that you get scared. Take an example of a child. Child gets scared, but then if there is someone with the child, then the child will be like, okay, now I have someone with me. So the thing is that the child is not scared of the dark, but is scared of being alone in the dark. So when you know that, yes, there is someone with me, you have that sense of, you feel that sense of comfort and safety. And then limiting news consumption. So we all know, like, it's all over the news, the number of cases that we see, and then the number of And that's so it actually triggers that fear of uncertainty that we have. So what we can do is maybe we can limit the time uh, we spend on social media or news for that matter. And most important is our sleep. So sleep is the time when you actually you give your mind and your body rest. So that is actually very crucial for us. So maybe we could try to avoid it, try to avoid watching it for 2 or 1 hours before sleep. So that would not trigger your brain into thinking it while you're sleeping, and would also minimize the thoughts that you have. And another is pause and connect with your thoughts. So like we all have all kinds of thoughts in our mind about being scared, and then I don't have my friends near me. So, and what people say is that some people say that stop thinking about it, but that actually does not help. So the more you tell your brain don't think, it actually comes back more to your head. So maybe you can just pause for some time, and then just feel it, what you're feeling. If you're feeling sad about it, if you're feeling angry about it, just feel it. But don't hide it back, like, okay, I won't think about it, I won't think about it. That actually adds more pressure. And another is acknowledge how you feel. Yeah, so just feel what you're feeling, and just say that, yes, I'm angry about it, like, I'm sad about it, and just let that, and just feel that sadness. And then creating a flexible and daily routine. So we all know that routine, having a routine is very important for us. And we actually had that before the lockdown, but after the lockdown, life has become difficult. And then we have lost the timing, we have lost, our timing of sleep, eating, it has got disrupted. So what we can do is maybe you can create a flexible routine, but then have a routine every day. And then there's also this thing, like, if you have this routine sorted out, like 9 to 10 I will do this, and 10 to 11 I will do this. So when you try to match with the timing, that's when it actually adds to the stress. So maybe you can just tell yourself that, yeah, after food I will walk, I will go out for a walk, and then after walking, after returning, I will sit down for study. But try to avoid setting up timing, like 8 to 9 I will do this, 9 to 10 I will eat food, and then 10 to 11 is my time for this and that. So just maybe we can try to avoid setting up actual timing, but then just have that sense of flexibility throughout the day. And then including physical movement, which is very important. And then physical movement does not only mean gymming. Like, physical movement can be just taking a walk, or just stretching out in your room, or doing yoga, or walking around the block, walking around the house. It could be anything, physical movement. And then deepening a social interaction using technology. So now, as we know, our physical we have this physical constraints of interacting with people. So now the actually, to say, technology has actually come to our rescue in regard to this. So what we could do is uh, instead of just asking somebody, hi, hello, how are you, just 1 2 minute thing, maybe you could have a deeper connection and chat more, asking, not just saying how are you and then bye. Maybe you could just ask, okay, how are you doing, how is work going, have the uh, deep interactions. And then strengthening social network. So these are tough times, and then we need the social support that we have. So if you could, maybe if you want to, and if you could, maybe you could broaden your social network, and then reach out to friends, reach out to family, and get and be connected with them. And then hobbies, like, this is completely up to you. Like, there may be something that you had wanted to do, but then you could not. So maybe now, if you have more time, maybe you could want to pick up, maybe you could learn cooking. And then cooking is a life skill, and it does not it's not mean that you have to be a master chef or something. Cooking is a life skill, irrespective of being male, female. It actually is beneficial to us. So cooking is something that maybe if you want, you could pick up. And then practicing mindfulness, this is actually very important. And it's, when we say meditation, most people think that meditation is just sitting quietly in a room. in a lotus position. But that is not only meditation. When you put your mind and focus into what you're doing at the present time, that is also meditation. Suppose somebody likes, playing the guitar, somebody likes listening to music, somebody likes painting, and when you put your whole soul and mind into what you're doing, that is also meditation. And then at the end, seeking professional help when you need. So like Tanisha said, when you feel that you need help, just you can just reach out to people. And while we have friends, we have family for us, but sometimes, people, they can't relate to, and they don't understand, and it's okay. So that is why we have professionals, mental health professionals. You can reach out to them and share with them. So when I say all this when I put the strategies of coping, it does not mean that it is the only way. Like, people have their own ways, and it's completely subjective. Like, you can do what works for you. And then here, yeah. So this is something that I came across. Sometimes in periods of stress, people find strengths in themselves they didn't know they had. This was by Joan Asarno in his professor of psychiatry. So this is actually, kind of true, I would say. Like, there is also this quote that, you never know how strong you are until you have to, face the circumstances. So it's kind of in that line. And so, the resilience that we have, it has actually shown in the pandemic, that the human ability and will to fight against the adversities which we face in life. And then the government had issued, practice physical distancing, practice social distancing. But I would say that is that is that is not that should not have been actually the case. That's like garbage. So it should have been practice physical distancing and not social distancing. So physical distancing is like you keep away from people, you maintain a distance. But social distancing is you're still connected, no, with people. Like, you can reach out to your friends, you can keep a distance from them and talk to them. You can reach out to them over internet, or you can make a call with them. So social means that, um, focusing on maintaining connections. Yeah. So on the next slide, I have put up some this mental health helplines. You might want to take a screenshot of this. If you want to reach out to people, if you want to reach out for help or seek professional help. Yeah, that's it.
Do I move on to the next slide?
Yeah, please. I think we've come to the end.
Okay. Okay, so should we start taking questions? Celesty?
Yes, we can.
Okay. So first of all, Rajnanda Langthasa says one query: the IQ level of a child as well as adult related with mental health. Is there any psychotherapy to address or increase IQ level of a child? If the child is suffering from any kind of intellectual disability, then no, we cannot increase the IQ level of a child. But if the child is a regular child, then there are many memory games to play, many kind of uh, memory related games, or reading books, for example, increases this one IQ level. uh, so yes, we can increase, but not to the level key, it comes out to be extraordinary. We are all born with It's a matter of genes, how genes express themselves. So no, we can increase to the child's optimal potential, but beyond that we cannot. Is that clear, Rajnanda Langthasa? Okay, so moving on, Preeti Hojai. So I read somewhere social workers have the license to conduct counseling. Is this true? Okay, so social workers with who have specialization in mental health, yes, they conduct counseling, but it is to bridge the gap between if there are psychologists are not available, then yes, they can conduct as a primary level care. Is that do you agree with that, Celesty?
Yes. So people are confused, and that's okay. It's fine. So to add to what Tanisha said, we don't really focus on what people call its treatment. We don't really do that. It's mostly to minimize psychosocial effects, psychosocial mental issues.
Mhm. So, so Hidji Asnu has more or less asked the same question. So, there was an error on my part while saying that, you know, uh, social workers also conduct therapy. Yes, they do conduct, like Celeste said, but they focus more on psychosocial issues, and they don't give out treatment procedures and plans.
Yeah. So, to be a therapist, one has to have a certification on that
Mhm.
specific therapy that you are picking up. So, yes, a social worker could be a therapist if they have certification in that particular therapy.
Mhm. Also, a person with an MA in psychology, usually they cannot conduct counseling sessions. Usually you have to have a master's in counseling psychology, or either you have to have a diploma in that. Okay, Bonnie Nunisa, don't you think a little bit of stress is necessary to keep us motivated in our profession or studies? Yes. There's a difference though. Stress which keeps us to our working to our optimal best is called eustress. So when we have eustress, EUSTRESS. So when you have eustress, we are motivated to do. Our performance increases, our ability to do task increases, and we are more alert. But there's a fine line there. When it converts to distress, then that's where yes, there's a problem. Otherwise, stress, yes, it helps us.
It helps us perform better. Yeah. So the
Yes.
eustress is actually it's actually needed, and it's actually good.
Can I ask question? I mean, via this video rather than
Yes.
writing.
Yes, please.
Okay, so my another question is that people usually resort to, art of living and vipassana Buddhist techniques. I have also read in the slides that coping strategy is almost similar with, the other um, religious, or spiritual way. So to live a healthy, mentally healthy, would you suggest people to adapt such practices? If so, what if the person is not belonging to that religion? What would you suggest? Because we all are conditioned by certain religious beliefs.
So yeah, Tanisha, would you like to go first?
Okay, sure. So uh, when you say religious practices, so yoga, meditation, so these kind of things are more of a spiritual kind. Anybody can do it. So there's a difference between religion and spiritualism, right? So spiritual activities like yoga, meditation, or any Buddhist meditation methods for that matter, they help us a lot. And regardless of any affiliation which you have to your religion, you can im- put that in your daily life.
So, yeah, just like Tanisha said, religion and spiritual, they're different components. So, and, one thing to keep in mind is that, every human is different, every human is unique, their needs are unique. So, just because one therapy worked for somebody does not mean it will work for you. So, every therapy is, is customized, or it is specific only to the service user. It cannot be generalized. And there are many types of therapy. There is art therapy, there is music therapy, there is dance movement therapy. So there are many kinds of therapy which the service user can seek.
Although there are religious cult like sects these days who do practice strange kind of they propagate strange kind of beliefs, like if you don't suppose if you eat veg, if you eat a vegetarian, if you lead a vegetarian lifestyle, or if you maintain veg lifestyle, if you eat veg on certain days of the week, then you will find peace, you will find happiness. So these are very wrong again. So these are all they kind of what do you say, that religion hagede thangdau do, or the he blind belief systems alanga do meditation, yoga bubutula scientifically bo maika ki alternative forms of therapy away fudu buke in your daily life, apart from going for clinical sessions move to employ do, but uli cult like butu ade gene dong laba hamdao for your mental health.
Thank you.
Sohidzi Hasnu, how is suicide risk related to burnout? How can help work with at-risk populations for their own mental health? As a mental person, do we have to do also? We have to cope with lots of stress. So, Celesty, would you like to go, or should I?
You can go first.
Okay, so there is high incidence of suicide risk related to burnout. I don't know about the statistics in India, but in Japan, there has been studies on Japan where they work so much that the kushi uli raudu ki they resort to committing suicide. So the relation is that burnout ha uli jashi lengdu, uli jashi cope klefiadu, uli jashi stress dong do, that they bunchini work ha they don't have any time to spend with their friends, social interactions kom jadu, or they have self care ne time kom jadu, jibaling ba problem jadu, obanekle dada burnout jadu, and because of that they feel hopeless, they feel depressed, they are distressed, obanle hi suicide risk bangdau du bunchinekle hi. Now, how can healthcare professionals and others who work with at-risk populations care for their own mental health? So, therapists should also seek therapy from other professionals. So, for example, I am a therapist. So, any problem, so various kinds of things get transferred to me. Therapy sessions amlai jang laba ha mlai ni problems butu knahi anbo mental health hato ups and downs dong do. So for that angbo therapy siklai do other professionals ni ha. So mental health professionals should definitely seek therapy from for themselves. Also have to cope with to conduct counseling. Mental health professionals do cope with a lot of stress as they conduct counseling and therapy. That's why they go for therapy. They should go for therapy themselves.
Yeah.
Celeste?
So, yes.
Yeah,
So
your viewpoint.
Yeah. So adding to what Tanisha said, yes, indeed, even mental health professionals need help. Just because they listen to people does not mean they're immune to things. So I would like to add that psychology, knowing about psychology, it's not like you will be immune to mental distress. It just makes it just makes it easier for one to manage adversities. And then adding to what Tanisha said about, yes, and needing help, there's also this term called compassion fatigue, which mental health professionals face. That is, when you listen to problems, listen to people, it kind of you kind of become you kind of become, like, uh you tend to lose that empathy that you had. So taking break is actually very necessary to combat the compassion fatigue that people that professionals face.
Okay. The last question is mental health is a huge subject. Now, how will you compare mental health of developed countries with the ones that are developing? So, in developed countries, people are more aware of the resources that are available, and the stigma, although present, is a lot less compared to developing countries. This developing countries also do spend a lot of their health budget on mental health, while in India we actually slashed the budget for this year, mental health budget for this year. So you know how dismal the condition of India is. uh, so these are the mm, uh, problems, the differences between mental health of developed and developing countries. Also, in developing countries, there's a whole this one belief that if you pray to God, then your health, your relatives or anyone suffering from mental health problems, they will get cured if you pray enough, if you give sacrifices, if you maintain some diet, if you maintain some religious practices. So that's the thing in developing countries. We have a long way to go. Celeste, your take on this?
I'd like to add a small part. So
uh,
what we have, what we see in developed countries, like UK for that matter, or US, they have this counseling, the availability of services in almost every field. Like people actually have counseling sessions, before giving birth to a child or when a mother is pregnant. They have these
mm,
services provided. Like if they check if the parents are, uh, if the parents are financially fit to, give a good upbringing to a child. So while these services we still don't have. So that is one difference I would like to point out in developing and developed countries.
uh, what is your message to people right now in this global pandemic as a counseling psychologist and a student pursuing MASW in mental health? So, as a counseling psychologist, I would say talk more about mental health with your friends, with your relatives, with your children. Number two, if they are facing any problems, then if you are facing any problems, then you should seek help. Number three is maintain a routine in your life, so that everything does not become haphazard. And fourthly, I would add, if there are a lot of negativity with relation to media, print media and news these days. If it's stressing you out, then you should take a break. And social media also, if various news on social media is affecting you, then you should take a break. Celeste?
Yes. So thank you for that question. I would say, that we all know. I mean, we all know the future is uncertain. The vaccine is not here yet, and we don't know how long this thing will go on. So I would not say, that everything will be all right. Everything will be all right. Everything will be fine. No, it won't. I mean, this will go on for how long we don't know. But but we can, develop ways. We can come up with ideas to manage with it, and for that, we need a strong social support, a strong social circle. So be in touch. We can be in touch with our friends. We can be in touch with the family, and if there are some days where you feel very sad and angry, it's okay. Like I said, you don't need to tell yourself, I can't be angry, I can't be angry. It's okay. Just feel it. And then I would also say, reach out for help. It's not that you might not be comfortable with seeking professional help, and it's okay. You can talk to a friend, you know just be kind, just lend an ear to someone, ask them how are they doing, how is their studies going on. So these little things, it actually builds up. So you might for you it might be like, how will I asking how are you doing, be a huge help, but you never know what the other person is going through, so just being a little kind and listening to them, it will go a long way, and you might not even know if i- that half an hour, 15 minutes of conversation might actually stop somebody from taking up something, taking up a drastic step or something. So I would say, just be kind to everyone, and if somebody wants to talk to you, just lend a friendly ear, listen. So that would be that's what I would have to add.
Okay, Celeste, I would like to add something to what you said. So lending a helping ear is is the empathetic thing to do, but you should also make sure that the other that you are ready to listen. If you are not listening properly to what the other person is saying, then it might aggravate the issue also. So boundaries should be maintained there. Okay.
I
uh,
completely agree. That active listening, not just
yes.
sitting and listening for the sake of listening, but then actually giving your whole attention to what they're saying. Yeah. So thank you, Tanisha, for pointing that out.
Okay, so Hidzi Hasnu, so certain populations are higher risk of contemplating and attempting suicide. What factors contribute to this increased risk, and the measures need to be taken to reduce these incidences? So yes, certain populations are at a higher risk of suicide. Uh, the older population, due to their due to feelings of hopelessness, loneliness, they are at a higher risk of suicide. Also people with substance issues, abuse problems. During this pandemic they might be stressed out, and because of that they may attempt suicide. And genetic factors may also contribute to an increased risk. Your home condition, if you are facing domestic violence, all these factors do contribute to an increased risk in suicide. And the measures that need to reduce the incidence in these populations, things that need to be addressed are, suicide awareness should be there. Suicide prevention and awareness. The first is, if you know any people, any person who you suspect is and at the risk of committing suicide, or is at the risk of harming oneself, then you should definitely stay with the person, ask him what is happening or not, and make sure that the person is completely stable when you leave him or her. And the second thing is, if you are not able to do that, then um, you should go to the primary. If the person is an as a young person, then you should go to the primary health giver, and ask them to keep them company, and then uh, go to a psychiatrist or somebody who can help, a mental health professional. And all these things one should keep in mind. Or the risk factors la bangbi, or the suicide leman risk bangnut skade ning dong phalaba ham da bushpong jang until bushpong stable. Or the ninja dong fiat skade bun bumafa, yeah, somebody who is in charge bujang company klemanang do, or they definitely should seek help at this point. Celeste, your thoughts?
So yes, always trying to reach out, and I mean look out for the signs, I would say.
Mm-hmm.
So if you see that somebody is not in their usual self, so it might be that somebody is sleeping more than they usually do, or eating a lot more or less than they do. So reaching out and for those signs, it's actually very important. And I would say is that as you are the person, the first person there to witness it, the first thing you could do is just ask them, like if they're facing something, just be there for them emotionally. And yes, like Tanisha said, just make sure that they are in a, yeah, kind of in a stable situation when you leave them. And if you see that it's persistent, like it's going on for months and days, what you could do is you definitely you should reach out to a mental health professional. The person might not be comfortable reaching out, so maybe you could take the initiative, you could take the step, first step. I hope that, I hope we answered.
Mhm.
Yes, hello, hello. Yes, come. Okay, okay. Thank you, everyone. So, I'm Anuj, Secretary of DSL. Would like to propose the vote of thanks for today's talk. Firstly, I'm grateful to all the participants for making time and joining us today. I thank our speakers from DSL, Tanisha Langthasa and Celesty Hakmausa, for initiating this program on creating awareness of mental well-being, which is the need of the hour. Lastly, I thank the entire team at DSL for making this program successful. So we hope to conduct more such programs in the future, and we hope to see more of you participate. So thank you all, and Jutai to all. Thank you.
So Derika Langthasa, she has written, thank you, one of the best sessions conducted, something we all needed and relate to on a daily basis. Yeah. I completely agree with you, Derika. Thank you for having us here. Thank you to DSL for inviting us over. Thank you for, making time. It's Sunday, it's, sleeping time. I mean, having a relaxing day, but you still made time, like you gave almost 2 hours. So thank you so much for that. Thank you for coming.
Yeah, thank you to everyone who were present here. It only shows how much you want to learn, and we Celestia and I appreciate that you took the time and effort to be present here. I also thank DSL for having us, and also Miss Rakhee Naiding for her constant support. She has been very supportive to us, and so thank you. Okay.
Yeah.
Yeah.
Thank you, Jutai.